We do know that climate change alters how we relate to other species on Earth, and that matters to our health and our risk for infections. As the planet heats up, animals big and small, on land and in the sea, are headed to the poles to get out of the heat. That means animals are coming into contact with other animals they normally wouldn't, and that creates an opportunity for pathogens to get into new hosts. Many of the root causes of climate change also increase the risk of pandemics. Deforestation, which occurs mostly for agricultural purposes, is the largest cause of habitat loss worldwide. Loss of habitat forces animals to migrate and potentially contact other animals or people and share germs. Large livestock farms can also serve as a source for spillover of infections from animals to people. Less demand for animal meat and more sustainable animal husbandry could decrease emerging infectious disease risk and lower greenhouse gas emissions. We have many reasons to take climate action to improve our health, and reducing risks for infectious disease emergence is one of them. Climate change has already made conditions more favorable to the spread of some infectious diseases, including Lyme disease, waterborne diseases such as Vibrio parahemolyticus, which causes vomiting and diarrhea, and mosquito-borne diseases such as malaria and dengue fever. Future risks are not easy to foretell, but climate change hits hard on several fronts that matter to when and where pathogens appear, including temperature and rainfall patterns. To help limit the risk of infectious diseases, we should do all we can to vastly reduce greenhouse gas emissions and limit global warming to 1.5 degrees. Given what we know now, it is likely that people who are exposed to more air pollution and who smoke are going to fare worse if infected with COVID-19 than those who are breathing cleaner air and who don't smoke. Air pollution is strongly associated with people's risk of getting pneumonia and other respiratory infections, and with getting sicker when they do get pneumonia. A study done on SARS, a virus closely related to COVID, found that people who breathe dirtier air were about twice as likely to die from the infection. In places where air pollution is a routine problem, we have to pay particular attention to individuals who may be more exposed or vulnerable than others to polluted air, such as the homeless, those who don't have air filtration in their homes, or those whose health is already compromised. These individuals may need more attention and support than they did even before coronavirus came along.